The next couple of charts represent an analysis by scientists from the National Cancer Institute of the National Institutes of Health. And these data were presented to the 2010 Dietary Guidelines Committee back in April of this year. The NCI scientists used data from the National Health and Nutrition Examination Survey, which asks Americans what and how often they eat and drink all foods and beverages. There are over 4,000 different food and beverage items in the NHANES survey. And for this analysis, the NCI scientists judged how to combine these 4,000 foods and beverages into 96 mutually exclusive categories of foods and beverages. The NCI analysis shows, and it probably doesn't surprise you, that 95% of our calories in our food supply come from something other than soft drinks. Clearly, if we are serious about addressing the obesity problem that we have in this country, we need to look far more broadly than soft drinks. The NCI scientists also presented these data. Most notably, grain-based desserts are actually the #1 source of calories in our food supply at 6.5% of calories. And if you consider all dessert items, the combination of grain-based desserts, dairy-based desserts, and candy represents over 11% of our calories. I'd now like to turn to a few studies and review articles that show that beverages are not associated with weight gain. And as I said a little bit earlier, none of these studies were supported by the food industry. These studies were supported by public funds from the National Institutes of Health or the Department of Health and Human Services. The bottom line of this study that was published in the New England Journal of Medicine in February this year is that calories are calories regardless of the source. This was a 3-year, multi-center, randomized clinical trial that compared the effects of calorie-reduced diets on body weight. The NIH study was conducted at the Harvard School of Public Health and Brigham and Women's Hospital in Boston and the Pennington Biomedical Research Center of Louisiana State University. In this study, more than 800 overweight adults were asked to follow one of 4 weight loss diets for 2 years. Regardless of whether the reduced calorie diet was high fat or low fat, high carbohydrate or low carbohydrate, high protein or moderate protein, when fewer calories were consumed, the people lost weight. This NIH study was conducted at Harvard and published in the Archives of Pediatric and Adolescent Medicine, and it shows that all calories count. Even consuming too much skim milk can lead to weight gain. The study of more than 12,000 children found that children who drank more than 3 servings each day of milk were about 35% more likely to become overweight than those who drank 1 or 2 servings. The senior authors noted that the children who drank more than the recommended 3 servings a day of milk probably gained weight because they were taking in too many calories, since most of the children in the study drank low-fat milk. And in an interview that Dr. Berkey granted to Food and Drink Weekly, she stated, "Our study may suggest that it is not milk itself that is associated with weight gain, but the calories this beverage contains." So clearly, all calories count, and overconsumption of milk, including skim and 1% milk, can contribute to obesity, just like overconsumption of any food or beverage that has calories in it. This review was funded by the World Cancer Research Fund and was published in the International Journal of Obesity this past summer. This review concluded that, quote, "The epidemiological evidence suggests that the consumption of beverages of any type is not associated with subsequent weight gain and obesity, although the results are inconsistent." Other reviews, such as one published by Janssen, which was funded by Health Canada, showed no link between adolescents' weight gain and soft drink consumption. And a 5-year study that was e-published on October 28th, just last week, and published in the American Journal of Clinical Nutrition, stated, quote, "Contrary to our hypothesis, sugar-sweetened beverages were not shown to be positively associated with weight gain. And finally, what does the UCLA report also state? On page 2 of the report, the authors state that 52% of adults who do not drink soda are overweight or obese. To my knowledge, the UCLA report has not been peer-reviewed. It was a telephone survey that asked adults to give their best guess on how often in the past month they consumed certain foods and beverages. It does not ask about all foods and beverages consumed or how much was consumed. And it appears that this was a very long and lengthy survey. Finally, this type of survey cannot establish a cause and effect relationship, and that is not what these types of surveys are intended to do. All of this tells us that a strategy that focuses narrowly on soft drink calories is certain to fail. A broader perspective that considers all calories is clearly required. In summary, the perspective that I have provided points out that calories are calories, and they all count. 95% of our calories come from something other than soft drinks. The UCLA report states that 52% of adults who do not drink soda are overweight or obese. We know that leisure time physical activity has not increased over the last several decades, but total energy expenditure from all activity has declined. And added sugars calories have declined, but obesity has continued to rise. Therefore, there is only one conclusion to be made from all of these data, and that is that balancing all calories consumed from all sources with all calories burned through all forms of physical activity is the key to solving this critical health problem of obesity. Focusing on one small segment of our food and beverage intake will not solve this problem. Furthermore, such a focus will fail to solve the problem, and it will distract us from putting effective educational and informational programs into place. Programs that encourage citizens to understand how many calories they need to achieve and maintain a healthy body weight, to read food labels for calorie content, to monitor how much they are eating and drinking, and more importantly, to be more physically active, to improve cardiorespiratory fitness, which is strongly linked to lower morbidity and mortality. That will achieve the goal that we all seek. Thank you, Senators, for your time and attention today.
Thank you.
Senator Padilla, members of the committee, thank you for the opportunity to speak with you today. My name is Margaret Leahy, and I am the Director of Health and Wellness Science for the Coca-Cola Company. I have a PhD and master's degree in food science from the University of Minnesota and a bachelor's degree in biology from the University of Missouri. I have worked in the field of beverage and nutrition science for almost 25 years. As a grandmother of 4, scientist, and employee of the Coca-Cola Company, I care deeply about the health of our nation. That's why it's especially important for me and Coca-Cola to be here today. In the recent American Heart Association scientific statement